Welcome back to Medical Coding with Blue. Today's episode is all about, did you fail the CPC exam? Should you try the CCA next? If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So if you're brand new to medical coding or you're thinking about getting into a career in medical coding, these are some of the credentials that you will have the option of taking once you've completed your self-study or once you've completed a program in medical coding. So the CPC is a Certified Professional Coder exam, and that is with the American Academy of Professional Coders. The American Academy of Professional Coders is a for-profit organization, and this means that they have lots and lots of credentials for you to choose from. But the CPC is their flagship credential. It is the one that is asked for a lot. Hands down, when you're looking at the job listings and they're looking for a HEMA or AAPC credentials, they will ask for the CPC from AAPC. So if you have no prior experience, you'll have an apprentice designation on your credentials, so you'll be a CPC-A. But if you go through an AAPC program and you complete Practicode is just a collection of records for you to practice on. It's 600 records that you could be coding from. And that's what they consider what a new coder would do in their first year of working. It is not work experience. It is an educational product. Okay, so it's not an internship, not a thing that you're doing to gain experience. No, absolutely not. It is a educational product. Okay, but that being said, on that, right? It is all outpatient coding. When you're studying for these tests, right, you got to make sure that the exam that you're going to be studying for, that you're actually preparing for it, okay? Because each one of these credentials has a different book requirement, okay? There's different manuals you got to use, and there's different thought processes that go into these certification exams. So for the CPC, right, you will be tested on outpatient coding. And with AAPC, they have theirs set up differently. They have the option where you can pay to take your test twice. So if you fail it once, you can take it again if you pay that fee. And so that's something that is attractive to some people because they say, well, I'm a nervous test taker, in which that is not technically a thing, okay? But that's another episode for another time. And so I will say this. The person, I'm going to read their message here in a minute, but let me explain what the CCA is. The CCA is a Certified Coding Associate, and that is a credential with the American Health Information Management Association. This credential says that you can code not just outpatient coding, but inpatient coding as well. So you get the best of both worlds. And what this means is you're able to apply for more jobs because you will have, according to your credential, the competence to be able to code basically anywhere, okay? And so that's one of the advantages of having the CCA. Now, in the industry, on Facebook and online, all these places, you will have ignorant people, okay? You will have ignorant people. And these ignorant people will think and say, oh, no one asked for the CCA, which is a load of garbage, okay? I'm going to try to keep my words. But that is a load of garbage. Why? Because the same people who say, oh, no one asks for it, are not looking at the job listings. I look at the job listings. Not only that, I had the CCA, or the Certified Coding Associate. I had it for 13 years before I let it go because I had to take another credential exam, which I got my CCSP first, and then I got my CCS. So that is because things are changing in the background, all right? And that's why I had to, all right? If a HEMA would let me, I certainly would still maintain my CCA, but they don't because my credentials have superseded that entry-level credential. Now, that's the only thing that people are getting hung up on is, oh, it says entry-level and no one asked for it. People do ask for it. When you look in the job listings, they will ask for the CCA all the time, okay? And not only that, the CCA holder is going to have, again, more versatility on where they can go because they can not only apply for the outpatient positions, but they can apply for inpatient positions as well. So that's a benefit and advantage of having that credential. Now, I kept it because I wanted to change hearts and minds, in which I did. But there's still some people that are just ignorant, and you can't argue with the ignorant. Okay, I'm just going to say that. But I got this message, and This kind of message, especially coming from the next generation of coders is coming up, it worries me. It worries me because, one, the person didn't do their research. That's number one. Number two, you need to look at this from a different point of view. When you are about to take any medical coding certification exam, whether it is a CCA, the CPC, the CCSP, or the CCS, if you're taking any of these credentials, you have to be competent. And it's not about guessing your way through and trying to change, oh, well, if I can't pass this test, then I'll go jump to this test. They're all different, and they all require different levels of knowledge. And yes, while you can sit for the CCA or you could sit for the CCS is the Mastery Medical Coding Certification. That's a certified coding specialist offered with the American Health Information Management Association. And you don't have to have experience. A lot of people get hung up on that too. It says it's recommended. Recommended, it means it's recommended. It doesn't mean it's required. There's a difference in the two words, okay? So it just means that it helps if you have experience, because the CCS is a hard exam to pass, just like the CCA is a hard exam to pass. But let me get into the message real quick and then we'll continue on. So the person says, thank you. I'm taking my test soon in 2 weeks for the CCA, and after failing the CPC by 7 points. I didn't realize there are so much more reimbursement methodologies on the CCA. Do you have any videos on reimbursement methodologies? I scrolled through and I couldn't find any. That's my weakest area. Now, before you say anything about my reaction, here's the thing, guys. I have over 1,400 videos on my channel, and a lot of them are tips on medical coding, how to study medical coding, how to study for this exam or that exam, and blah, blah, blah. And here's all these resources and free references and free resources, things like that. Don't sit here and tell me that you can't find it. Don't sit here and tell me that you can't find it, because I find that personally offensive and insulting, because I work very hard to give you guys content that is going to help you and guide you in the right direction, or hey, this is where you can start to find good resources and references. And so I expect people to look through the description box. I expect them to look through and watch the videos, especially when I talk about free resources for medical coders, tips on how to study and things like that. That's what I expect. So I said, I don't think that is your weakest area. Reimbursement, while it is very important, the bulk of all of these exams is the coding knowledge and skill. That is the bulk of all of these exams. CCS, CCA, CCSP, or CPC. The reimbursement comes in a close second for all of them. So I said, are you practicing looking up the codes? You know there's ICD-10 PCS on there as well, which was not on the CPC. I have posted resources several times. Look at the domains for the CCA and look up on the reimbursement domain things that you don't know. So they replied, thank you, I'm going to search again. I didn't realize the two tests were so different when I started studying for the CCA. So when you sign up for these tests, right, it tells you exactly what books you need, and it tells you what the domains are. So you have this information before you sign up for it. The fact that this person haphazardly, by what they wrote, haphazardly went and just signed up for the test, and oh, I didn't realize it was all of these things. So it didn't catch your attention when you saw that it says that there's ICD-10-CM and ICD-10 PCS and CPT on this exam? You didn't see that? So the thing that they also said that I want to point out is this. They failed the CPC by 7 points. Now let's look at this. The CPC exam is a 4-hour, 100-question exam. That means this person literally missed, the passing score is a 70. This person missed 37 questions on this exam, on the CPC. And I guarantee you, the bulk of those questions were coding questions, because of course it's all CPT. They have some reimbursement questions, some very few E&M questions, very few medical terminology questions, very few of the other things that you need to know as coders. So the bulk of what was missed on that exam was the coding knowledge. And then you expect to go and take a test like the CCA and thinking that you can pass it in 2 weeks. I don't know how long this person's been studying, and I don't know how many hours that they have spent studying. But I will tell you this, if you are not studying for 20 hours per week, you will not pass. If you failed like this by 37 points, you will not pass again the next time. Oh, it was my nerves. It has nothing to do with your nerves. It has everything to do with the fact that you don't know what you're doing. If you are not putting in the time to practice, which it is absolutely possible to practice 20 hours per week on your coding, and please save me your excuses on, oh, I have a family and a full-time job and I work 40 hours a week. So you don't have 30 minutes in the morning when you're sitting there brushing your teeth to be listening to something about medical terminology, about anatomy and physiology, about HIPAA, or about anything about reimbursement, learning about MSDRG and DRG and what that means. You don't have time to listen to that stuff while you're getting ready. You don't have time to sit there on your lunch break for 30 minutes where you could be working with flashcards, because Quizlet has flashcards for every single medical coding certification exam you could ever want, plus the topics that are covered on those exams. You don't have time to sit there and eat and go through and flip through those flashcards, because even if you're getting 15 minutes of eating and 15 minutes of looking at, that's still time that you're putting in. And then on your drive home, you could be listening to something, right? On through your Bluetooth. Everybody's got a Bluetooth, unless you got an older car, that's okay. But most everybody has a Bluetooth in their vehicle. You could be listening to something. You don't have to watch anything. You could just listen to it. And then you have 1 hour in the evening, once you get home, and you fix the kids their dinner, and you take care of everything around the house that you need to, that's keeping you from doing all this study, right? So you do that, and then you get to yourself, or the kids are put to bed. Okay, well, now you got an hour that you could be working through your workbook. Then you take a break after that 1 hour, because you don't ever go past 1 hour of study, because you're not going to retain anything. And then you take a break, 10, 15 minutes, 30 minutes, whatever you want to do, come back to it and start again with your workbook, looking up the codes, and not wasting your time with stupid tabs, highlighting, writing, circling. Don't do anything in any of these manuals. Why? Because with these manuals, they're written by doctors and scholars. Are you smarter than a doctor or a scholar? Because the vast majority of us have not gone to medical school. There are some doctors that do get their medical coding certifications, which I personally think is fantastic. But for the vast majority of us, we haven't been to medical school. So if you think that you're smarter than doctors and you write all these things in there, and then by the time you know it, it's all cluttered. Everything in your book is all cluttered. And then you're just so proud of it. Some of you are just so stinking proud of, oh, look, I wrote all these things. Did you study? Because you're not going to have any time to be looking at any of those notes, anything that's highlighted and circled. And if you have excessive writing in your book, and you go to a Pearson View Center, and the person's doing their job properly, they can stop you from going into that test center with those books, because they have too much writing. And it looks like you're trying to cheat. And if you don't believe me, you didn't look at the candidate hand guide for that exam, did you? Where it says that they will not allow your books if you have excessive writing. A little bit of writing is okay. But where you're writing out all these things and circling, doing all this stuff and putting all these handmade tabs, they'll make you take those handmade tabs off. Oh, you will not be able to use those tabs. Oh, well, Blue, I need them. No, you don't. That is a lie perpetuated by people who don't know how to study. That is a lie perpetuated by people who don't know how to study. Because here's the thing, guys. It's not about how many tabs can I have on my books. How many notes can I write in there? Can you look up the code that you're looking for? Do you know how to go through the index and then go through the tabular and verify and do all those things? Do you know how to do that? Probably not, because you've been too distracted doing all those other things. So if you, going back to how you can get that time in, you do 1 hour and then you take a break and then you do another hour. That in one day is 3.5 hours. Everybody has that. If this exam is important to you, you will make the time. You will find the time. You will look for pockets of time. And if you say, oh my gosh, Blue, this is it's too much, it's too overwhelming, my channel is not for you then. My channel is not for you. Because my channel is for people who are serious. about learning and want to be competent. Because guess what? Everything that you code is going to affect providers. It will affect patients. Patients who are already sick, who are already paying a lot of money for their care, or even if they're not paying a lot of money for their care, maybe they're on a program, somebody is going to have to foot that bill. And in order for us as coders in the health information side to do things right, we need to make sure that we are competent. And that starts by being certified. That's how we prove that. But in order to get there, we don't need to be, oh, well, I failed the test, so let me try to take the CCA. Now, I know the person didn't say it, but I know somewhere deep down, they may think, oh, well, the CCA must be easier, which is a stupid thing to say. Yes, it is. That is a stupid thing to say. You know why? Because the CCA is not easier. It's got the most unique domains of all the medical coding certification exams. Now, when you think about it, they say, well, with AAPC, they have all of them, all the chapters listed and everything. That's not separate domains. Separate domains is coding knowledge and skill, reimbursement, queries, that kind of thing, regulatory compliance. Those are different domains. The CCA has the most unique of all the medical coding certification exams. That means you know a smattering of all of this knowledge. That's why I say the CCA coders out there are very strong coders. And I would trust them. I would trust them more than anything, especially when it comes to new coders out of the gate, because this person is versatile. Not only that, they know a lot of different things. So, but here's my thing. If you missed 37 questions, and let's just say the bulk of those questions was because of the coding, which undoubtedly it is, but you missed 37 questions, so you missed the bulk of the CPT book. You think you're going to be able to get through ICD-10 PCS just as quickly? ICD-10 PCS, if you don't know, that's the coding manual for the inpatient procedures that are performed in the hospital, right? It's to ensure that the facility gets paid for the bed, for their staff, for the use of their equipment, for all of these, the supplies, for the food, for everything. It ensures that all of the services that are performed there are accurately captured and that they are submitted to the insurance. Well, guess what? With CPT, these codes are already formulated. There are 5-digit codes with CPT, and you can add modifiers to them as applicable and things like that to tell more of the story. You can have add-on codes and things like that. But with ICD-10 PCS, you have to build these codes. These are 7-character codes, alpha and numeric. And if you miss one letter or number, or you transpose it, or you do something funny with it, the whole thing is wrong. So this ups the ante for people who know how to do ICD-10 PCS coding. And I will tell y'all that in 2021 was when I surrendered my my CCA, because once you get a credential that supersedes the CCA, which if you get the CCSP, which is just outpatient coding, the Certified Coding Specialist Physician Based. If you get that one, or you get the CCS, the Certified Coding Specialist, that supersedes the CCA. So you can no longer carry it. When I see people that they still carry the CCA and then they get the CCS, get out of here. That just looks like you don't know what you're doing. You're supposed to let that, you're supposed to drop that from your name because it's superseded. You can't do that. Even it says on the HEMA website. So the thing about it is, going and doing those things in 2021, I took the CCSP first. That's because that's all the outpatient coding. That's all I had been doing for 13 years. And so I passed that one pretty easy because that's no big deal to me. I've been doing outpatient coding for 13 years. I've had more than my share of experience. But it took me all the way till late September, early October, from April all the way till late September, early October, I was studying ICD-10 PCS. Now, I did know a little bit about ICD-10 PCS, but it wasn't as strong as, of course, I was with CPT, having all those years of experience. So I had to really learn from scratch. And even though, again, I had enough knowledge to get around, it wasn't as comprehensive as I wanted. So it took me all those months, a little over 6 months, to get comfortable enough to say, okay, I'm ready to take the CCS, which is the gold standard of medical coding credentials. There will be other people who will say other credentials are the gold standard, but really nothing and no one beats the CCS. And I'm not saying that to be like, oh, all these things. No, I'm saying it because that's an industry thing. When you look at these job listings, you can look at yourself. You look yourself. When you look at the job listings, hands down, they will ask you for a CCS. They will ask for that. And if you have 2 candidates, if one of them has a CCS, more than likely the candidate with the CCS is going to get the job. Why? Because, again, you're showing that you have mastered inpatient coding and outpatient coding, that you are versatile, that you can go anywhere, and that they can put you anywhere, which makes you even more valuable, especially a coder who knows inpatient coding and outpatient coding, knows how to apply DRGs, MSDRGs, and that kind of thing, knows about present on admission, knows how to sequence and do all of those things that is so specific on the inpatient side, because that affects money at the end of the day. If the bottom line is if you don't know how to sequence, you're going to be costing the facility money. And that's where it gets a little hairy. It's the same thing if you don't know what you're doing on the outpatient side. You're costing the physician money. You're costing the patient's money, because that's where we're getting these bills from. It's the codes that we select as coders. So don't go into thinking that, oh, well, if I failed the CPC, I'll just go take the CCS, the CCA. You just signed up for a harder exam. You're signing up for a harder exam. If you're jumping from place to place, it's, again, what are you doing? You need to look at the domains. You need to look at these domains. The domains is the things that are topics that are covered. And if you see there's something on there that you don't really understand, like maybe you don't understand HIPAA, maybe you don't understand DRGs, you can do a simple Google search. There's no thing, because yes, I do have a book that I recommend, the medical law and ethics for healthcare professionals or something like that. It's in the description box below, but a lot of y'all just don't even pay attention, because I still get questions like that. Well, what resources do you recommend? Absolutely not. It worries me, because you shouldn't be asking me something that is so simple. If you're at the point where you're taking your exam already, you should already know how to Google things. Googling, everybody has the same access to Google as I do. And it is just a simple Google search. You don't know about release of information? Put it into Google. You don't know about present on admission? Put it into Google. All of these things, you just have to put it into Google. E&M, Blue, E&M, evaluation and management. What is your problem with it? Is it the modifiers that go on evaluation and management? Is it the leveling? Is it where do these codes apply? All of that can be answered by looking in your book, in your CPT manual, and also through Google. You have a specific question about that? You want to know about modifier 25? You can type it into Google, and tons of articles will pop up. So again, a lot of you are making this harder on yourselves than it needs to be. And again, I was saying the 3.5 hours, and then I stopped and I talked about something else. But when you are studying that 3.5 hours a day that I just ran through, 30 minutes in the morning, 30 minutes at lunchtime, 30 minutes in the afternoon, 1 hour and 1 hour, you do this consecutively for 5 days, that's 17.5 hours that you put in. And then all you have is 2.5 hours on a Saturday or Sunday. And I've talked about how you can break down the time. I've posted it many times. I posted sample schedules, I put like from 7 to 7:30, and then from 11 to 11:30, and then from 4 to 4:30, and just different ones, so that way you guys can see. You can put the time based on however your schedule goes, but as long as you're taking those breaks, studying only 30 minutes at a time or 1 hour at a time, and then sitting with your books. Finding a mentor will help you for free. or if you're really stuck and your teacher's not helping you and you just really don't understand, you can go on LinkedIn. You can ask for tutor recommendations. Tutors come at all different price points, right? Every single one of us charges a different rate for our services, and mine is in the description box below. And so I will say that the quality of the tutor that you have is based on, you know, their experience. How well do they like it? How are you going to be meeting with them and that kind of thing? Whenever you book with me, you just tell me what time that you want, because I'll send you a list of available times. And then you let me know what time you want. And then we meet. We meet over Zoom. We talk about your specific problem. I don't do like lesson plans. A lot of people will ask me that. I don't do lesson plans because that's a school. I answer your questions. No, I do not help. If you have like you're taking like a job assessment test, do not ask me. I will not help you. That is unethical. Okay. But I will explain things that you're stuck on in school. If there's something that you're stuck on and you need to like go over it and you need to figure this out and things like that, we can talk about it. Okay. If you have your workbooks and you need me to explain something, that's what I do when I do tutoring. Okay. So that's what you get with me. But again, you can pay for a tutor. Sometimes you may have to do that. And a mentor will help you for free. And please don't ask me to be a mentor, because all the videos that I do on this YouTube channel, that's the mentorship that you get from me. I do not have the time to help anybody one-on-one like that for free. I don't. There's just too much. There's too much on my plate already. And I need to make sure that I am available for my clients and for the people who are helping themselves to learn more. I need to be available for them. Okay? And they've booked with me. I need to be there for them. All right? So with that said, don't think the CCA is any easier. You better make sure that you're studying for 20 hours per week. 3.5 hours per day, 5 days, 17.5 hours. And then 2.5 hours on a Saturday or Sunday. And you do this consecutively. I recommend studying for at least 3 months. Consecutively at 20 hours per week. You will be ready walking into that room. But if you feel like you're ready sooner than that, then absolutely, you go right ahead. But for those of you who need a little bit more direction, I'm telling you that after you complete your program, if you want to study up to 3 months, that's great. But that's as far as you should be going, because any longer than that, you're not learning anything. You need to nail down what you need to learn, or what's messing you up, so that way you can go ahead and try to get that resolved so that you can get to taking your exam soon, within those 3 months. Okay. So at least that's just my advice anyway. And show some respect for people who have these credentials, okay? If you're out here trash talking, or if you hear people trash talking, you need to remove yourself, or you need to say, hey, that's not true. Because at the end of the day, everybody's knowledge base is going to be different. Because there are competent people who have the CCS, and there are incompetent people who have the CCS. There are competent people who have the CPC, and there are incompetent people who have the CPC. So don't give me any lip about, oh, with this one. No, absolutely not. Absolutely not. And I would never, even though I'm with AHIMA, I would never trash talk AAPC. Why? Because it's what the industry is looking for too. Now, I respect both organizations mightily, right? I respect both of them. But again, at the end of the day, it's on the individual, and it's on their ability to be able to study that's going to make them a very good coder. And that's where you get my respect, is if you study, or you reach out for help when you need it. Okay, you find those resources, you use Google. Okay, there's all those resources out there, guys, and standing around asking is not going to help you, is it? I'm just saying. So with that said, I'm going to go ahead and wrap this one up. Best of luck to you. Make sure that you're studying 20 hours per week, and I'll see y'all next time. Bye.